Hey there, welcome back to our channel.
Today, we have an important topic to discuss: chickenpox.
It's a common childhood illness that can sometimes affect adults too. We'll be covering everything you need to know about chickenpox, including its symptoms, causes, prevention, and treatment. So, let's jump right in. What is chickenpox? So, what exactly is chickenpox? Well, chickenpox is a highly contagious viral infection caused by the varicella-zoster virus. It's characterized by itchy, blister-like rashes that cover the body. These rashes usually appear in waves and may be accompanied by flu-like symptoms. Symptoms and progression. The most common symptoms of chickenpox include fever, headache, fatigue, and loss of appetite. Shortly after, the notorious itchy rash begins to appear. The rash starts as small red spots which then develop into fluid-filled blisters. These blisters eventually scab over and heal within 1 to 2 weeks. Causes and transmission. Chickenpox is highly contagious and spreads through direct contact with an infected person's droplets, such as coughing or sneezing. It can also be transmitted by touching the fluid from the blisters. The virus is usually most contagious a couple of days before the rash appears until all the blisters have scabbed over. Prevention. Now, let's talk about prevention. The best way to prevent chickenpox is through vaccination. The chickenpox vaccine is a safe and effective way to protect yourself and your children from the virus. It's recommended by healthcare professionals for children and adults who haven't had chickenpox before.
Treatment and home remedies.
If you or your child has already contracted chickenpox, there are some things you can do to ease the symptoms. Over-the-counter anti-itch creams, oatmeal baths, and wearing loose-fitting clothing can provide relief. It's also important to avoid scratching the blisters to prevent infection and scarring. In some cases, antiviral medications may be prescribed to alleviate symptoms and reduce the duration of the illness. Chickenpox is also known to be a more serious condition when it occurs during adulthood. There are a few reasons for this. Severity of symptoms. Adults tend to experience more severe symptoms compared to children. This means that the fever, rash, and blisters associated with chickenpox can be more intense and uncomfortable for adults. Complications. Adults are more prone to developing complications from chickenpox. These may include bacterial infections of the skin, pneumonia, encephalitis, inflammation of the brain, or even hepatitis, inflammation of the liver. These complications can be more severe in adults and may require medical intervention. Weakened immune system. As we age, our immune system naturally weakens. This can make it harder for the body to fight off infections like chickenpox. Additionally, adults with certain medical conditions or those who are immunocompromised may have an even more difficult time fighting off the virus. Yes, chickenpox is caused by the varicella-zoster virus, VZV. After a person recovers from chickenpox, the virus remains dormant in the body, specifically in nerve cells. Later in life, usually when the immune system weakens with age or due to other factors, the virus can reactivate and cause a different condition called shingles, herpes zoster. Shingles presents as a painful, blistering rash that typically occurs in a specific area of the body, following the path of the affected nerve. The rash is often accompanied by symptoms such as tingling, burning, or shooting pain. While shingles can occur in anyone who has had chickenpox, it is more common in older adults and individuals with weakened immune systems. It's important to note that shingles cannot be directly transmitted from one person to another, but a person with shingles can potentially transmit the varicella-zoster virus to someone who hasn't had chickenpox before, leading to the development of chickenpox in that individual. If you suspect you have shingles or have been exposed to someone with shingles, it is advisable to seek medical advice for proper diagnosis and treatment options. It's important to note that while chickenpox can be more serious in adults, it is still generally a manageable condition. If you suspect you have chickenpox or have been exposed to someone with it, it's always a good idea to consult with a healthcare professional for proper diagnosis and guidance. That's a wrap on our video about chickenpox. Remember, chickenpox is a common viral infection, but with proper care and prevention, it can be managed effectively. If you suspect you or someone you know has chickenpox, it's best to consult a healthcare professional for a proper diagnosis and guidance. If you found this video helpful, don't forget to give it a thumbs up and subscribe to our channel for more informative content. As always, stay healthy and take care. Thanks for watching.